Susie Tegen is the Chief Executive of the National Rural Health Alliance, and she joins me now. Susie, when we think of floods, we think of lots of water. We don't often think about the real personal impact. What kind of damage is this doing to people in regional and rural Australia?
Well, the interesting thing is that 30% of Australia's population live in rural and remote Australia, and it doesn't just impact the individual, it impacts the whole community. And the floods have been damaging people's homes, their schools, their hospitals, their pharmacies and medical practices. And so it leaves a situation of hopelessness, or of what are we going to do now? And you mentioned agriculture before. I mean, agriculture already works in a global market which is unpredictable. They rely on weather patterns for their crops and their livestock. And so it makes an enormous impact in the short term, but also in the long term on the farming and agricultural primary industry sector, but also those allied sectors, those support sectors of those communities.
What about families? Everybody knows when you're under pressure, if it's financial pressure, whatever it might be, it puts a strain on your relationships. People separate, families fall apart. That's got to be a big issue here when people are under such immense pressure and going through such incredible trauma as well. What support is available in that way?
The problem with rural and remote communities in particular is that they already have access to less services than their urban cousins. And I would say that generally they have about 50% less services than urban people. And so while there might be psychologists, while there might be doctors available in the city, in rural areas, it is much more difficult to access. And so in the short term, people might be rebuilding or cleaning up, but in the quiet times, when people are going to sleep, then the impact starts hitting them. And so, it really does impact not only them and as an individual, but the whole family, the children that are traumatised, the services that are available. The last thing you think about is, oh, can I go and get somebody to help me, when you're actually trying to pull everything together just to have some normality or stability. There are quite a few different apps and services, and some of the emergency services are offering support, as are not-for-profits and clinical practices, pharmacists, so people have access to some sort of medical appointments. But a lot of the time, if you have a look at the maps, the emergency services maps, you can see that the majority of the time telecommunications is down. Electricity is down, so they're not able to access all the things that everyone takes for granted. And the long-term impact is where the support actually needs to be provided, because it's not going to be something that will be gone within 3 months, 6 months or a year. The rebuilding will take a long time in an environment that's already challenged and without services in the first place.
Yeah, you're absolutely right. And often the rebuild, particularly at the moment, is interrupted by another event: flood, natural disaster, more rain. It's never ending. We will keep on this. Susie, thank you so much for your time. We really appreciate the update.
Pleasure.